Did you know that nutrition is just as important as chemotherapy? Better nourished patients are able to get the right amount of treatment at the right time. Treatment is more effective on a healthy body. Nutrition decreases the risk of infection. Good nutrition helps patients feel better and heal faster. It can even lessen side effects. As inside Children's, every patient gets assigned a dietitian. The dietitian is a specialist who manages nutritional needs during treatment and can answer any questions you may have. Throughout the different stages of treatment, appetite and taste preferences may change dramatically. Patients can have loss of appetite due to nausea and vomiting. Some foods may taste differently than they did in the past, while other foods may all start to taste the same or lose their taste entirely. Patients may also begin to have specific cravings. Encouraging foods that are high in calories and protein, such as milkshakes, meats, dairy products, peanut butter, mac and cheese, and pizza, will help maintain an appropriate weight. A traditionally healthy diet won't apply to a patient going through treatment. The most important thing is getting as many calories as possible. The dietitian can also provide suggestions during times of experiencing poor appetite or taste changes as a result of therapy. Nutrition can be tricky, and sometimes certain medicines or other medical interventions are needed to help calorie intake stay consistently high. No one should feel like they have failed if interventions are needed. Almost all patients need help, and it's only temporary. There are many options available to fit everyone's unique needs. These options include a high-calorie, high-protein diet developed by the dietitian. This includes high-calorie drinks and foods. Appetite stimulants. This is a medicine that works to help the patient feel hungry. Feeding tubes. This includes both the G-tube and NG tube. Or IV nutrition through your central line. There may be apprehension about these interventions, but they are often necessary to help maintain good health, promote normal growth and development, and reduce complications. Both patients and parents are oftentimes worried about these interventions. It's important to remember that interventions help to optimize nutrition. They do not define who you are. Remember, our goal throughout therapy is long-term good health. Properly supported nutritional needs can lead to successful treatment, better recovery, and decreased complications. If you have any questions or concerns, simply reach out to your dietitian.
The Children's Hospital of Cincinnati does a wonderful job of explaining the gist of what dietitians do for their oncology patients. During my rotation at McLaren Hospital in Greater Lansing, I had a few patients undergoing treatment for various cancers. The vast majority of them had poor appetites, so much so that they would lose drastic amounts of weight in very small time frames. There is also an influx of oncology patients who have difficulties eating. This could be due to pain related to procedures or side effects of radiation or chemotherapy. Additionally, head and neck cancers in particular lead to mechanical issues with consumption and swallowing of food. It is important to consult with the speech-language pathologist in times like this.
My name is Debbie Froman. I'm a registered dietitian. I've been working as a dietitian for more than 10 years, and I've been a McMillan post holder since 2009. It can be quite difficult for people to eat a healthy, balanced diet after a diagnosis of cancer. They can experience a range of problems from nausea and vomiting to diarrhea and constipation. Their appetite can be poor. People might have taste changes. Chemotherapy and radiotherapy can sometimes leave people with a very dry mouth or a very sore mouth. And also the actual cancer may have an impact on someone's ability to eat and drink. Sometimes the tumour itself can be in the gastrointestinal tract, so it affects someone's physical ability to swallow or to digest the food. And so we may find that they start to limit some of the foods that they're having in their diet, and that can lead to missing nutrients, which we need to somehow get back into the diet. And some people find it difficult to eat and drink at all, and in certain circumstances, it might be that any food is better than none.
My name is Connor Lane. I'm from Ireland. I started treatment for a Ewing sarcoma, it's a bone cancer and soft tissue cancer. The eating problems I experienced during my treatment were taste changes. My appetite was not great. I lost a significant amount of weight in the beginning. I had the problem of getting the calories that I needed into me. And that was frustrating, especially on the days when you were just so tired and didn't want to eat.
Dietitians are experts in assessing the food needs of people who are ill. They will often work with an individual to identify any additional needs that they have. If someone's lost weight, the dietitian would normally work with them to try and get as many calories into their diet as possible. What we often find is that they just need to focus on whatever they can eat, whatever they enjoy. And it may be that normal healthy eating guidelines go out the window. So it might be that we recommend some extra fats or some extra sugars into their diet. For example, we might say to add extra butter or cheese or cream into mashed potatoes. It's really just about getting as much energy as we possibly